The interest in this research project began from seeing the wide range of patient responses to proposed orthodontic treatment. We've all seen patients with mild malocclusions desperately desire treatment, while others that would experience significant benefits ultimately refuse treatment, even if finances are not a concern. Our understanding of the decision to receive or not receive treatment from a patient's perspective is lacking. The aim of this study was to characterize the orthodontic patient's decision by expanding the list of factors, creating a conceptual framework modeling the process, and finding which ideas were most associated with yes and no decisions. To complete this objective, we found forums online that were rich in responses on decision-making concepts about orthodontics. The qualitative method used for the analysis was the grounded theory technique. 54 dimensions representing specific ideas and themes were created and organized to reflect all aspects of orthodontic decision-making factors discussed in this data. Some dimensions had already been identified in orthodontic literature, while others provided new insight. The dimensions were structured into 10 domains or categories. The domains were also organized into a conceptual framework that provides a visual model for the decision-making process. The internal and external influences, as well as the medicalization process, contribute to how the patient interprets the benefits and barriers of orthodontic treatment. The participants' yes or no decision was also recorded during data collection, and it was interesting to see how the decision correlated with the domains and dimensions they discussed. Perceived functional and psychosocial benefits correlated strongly with the decision to receive orthodontic therapy. These correlations were stronger than aesthetic benefits, but aesthetic benefits were discussed more frequently. Previously identified barriers to treatment such as finances, inconveniences, and risk of treatment were not significant deterrents to treatment, especially when compared to dimensions representing certain viewpoints and philosophies. The specific dimension most associated with the no decision was the idea that instead of fixing a cosmetic deficiency, someone should learn to accept themselves for who they are. The second dimension was the philosophy that it should be the child's decision to receive orthodontic treatment, not the adult's. The third dimension described how people have different thresholds for when there is an aesthetic deficiency that would require orthodontic intervention. The fourth dimension was the opinion that some malalignment could actually enhance someone's appearance by making them more unique. Most of these concepts had not been identified in previous studies. As expected, dimensions in the aesthetic, function, and psychosocial domains were most correlated with the yes decision. Using these results, orthodontists can better understand a prospective patient's thought process during an initial exam.